For years, autism was diagnosed much more often in boys than girls. In fact, the DSM 5 notes that autism is diagnosed 4 times more often in males than in females. But as more research is coming out, what they're noticing is something really important. So, where that gap may mean that girls don't have autism less than males, rather that they've been missed all these years. And from what I'm hearing when I evaluate women for autism, I'm hearing kind of the same stories over and over and over again. So where they had to learn how to study other people. They had to learn eye contacts. They had to learn to blend in. They had to learn how to rehearse conversations before they even happened. And from the outside, they may look socially fine, but internally, they're exhausted. So today, I want to talk about why so many autistic women and girls are missed when it comes to diagnoses, what the actual research says about this, and why making eye contact, having friends, being empathetic, being successful does not mean that you can't have autism. So first, let's look at the stats. Look at some of the history around this, to where historically autism has been diagnosed in males at a 4-to-1 ratio compared to females. And that's even referenced in the DSM-5. But as newer research is coming out, the research is suggesting that that gap may not be as big as we once thought. For example, a study conducted by Looms et al. In 2017 conducted a large meta-analysis looking at autism prevalence across multiple studies. So more specifically, they analyzed 54 studies. And in those studies, they combined all the participants, which added up to be close to 14 million participants, of whom 53,712 had autism. 43,972 were boys, and 9,740 were girls. And so they estimated the true male to female ratio may actually be closer to 3-to-1 in males to females. And this is a big deal because what it means is that there is a significant amount of females that have historically gone unidentified. Let's talk about another study. In 2024, Harrop and colleagues collected over 10,000 autism diagnoses over 20 years, that were given over 20 years. And what the researchers found was that male to female diagnostic ratio dropped from 5.64-to-1 in the year 2000 to 3.07-to-1 in 2021, suggesting that girls and women are being diagnosed with autism far more often than what they have been historically. So to me, the question isn't why are girls more autistic nowadays? The better question is, why were so many girls missed before? So let's get into that. One of the biggest reasons that I see that girls were missed historically is because of masking, or sometimes it's referred to as camouflaging. So there was a review article published by Cook et al. In 2021, and I'll put all of these review articles that I'm talking about down in the description in APA reference format for anybody who's interested in learning about these studies and actually looking deeper into the numbers. It's down in the description, so go check it out. So in these various studies, they examined women that were masking or camouflaging across these different studies. And one of the major themes that the researchers found throughout these studies was that women and girls, whether consciously or unconsciously, learned ways on how to socially compensate. Now, let me back up and actually explain the methodologies of these different studies a little bit, to where a review article is very different than a meta-analysis. So a meta-analysis being like one of the studies that I talked about before, statistically combines the data from multiple different studies. What a review article does is it reviews numerous different studies and articles, and it picks up on the different themes that are coming up from the different articles and their findings. What the researchers in the review article kept finding was that girls and females are really skilled at learning how to hide their autistic traits. So where they tend to study people, They learn facial expressions. They learn when and when not to make eye contact. And they tend to memorize social rules to where over time they appear on the surface very good at socializing, but internally they're struggling. Another reason why women and girls have been historically missed is that clinicians, diagnosticians like myself, have not been trained well enough to recognize it. And I'm not saying that to be harsh or to like bash on my colleagues. I say it because our understanding of autism has changed over time. Long time, clinicians were trained on what has stereotypically been the presentation for autism, and that was based on boys. So if a girl could make eye contact, hold a conversation, be successful, have empathy, have friends, well, then people would just conclude, well, oh, well, she can't have autism. She can make eye contact. But that's not how autism works. You can make eye contact and still be autistic. You can have friends and still be autistic. You can be successful in school and still be autistic. Or you can be a teacher or a doctor or a parent or a highly successful business person and still be autistic. So the question should not be, can this person socialize? The question really should be, how much does it cost them? How much effort is it taking? Are they performing? Are they scripting? Are they crashing out afterwards? Are they over analyzing every single interaction that they're having because they're unsure on what the rules are or if they said the wrong thing? And that's where the cracks are. That's where the nuance is. So if a clinician is not asking these questions, then that's why these girls can get missed. So another factor that I've seen where females are being missed is misdiagnosis and overlap. It's where I see a lot of women and teenage girls come in and they've been diagnosed with a whole range of other things: ADHD, bipolar, major depressive disorder, borderline personality disorder. And there is a lot of overlap between these various diagnoses and autism. So if they're already diagnosed with one of those things, sometimes clinicians can just kind of pile on what the symptoms of autism would be into one of those. And be like, oh, well, it's not autism. You already have this diagnosis, and this accounts for that. And I want to be clear, sometimes those diagnoses are accurate. You can have autism and ADHD and depression and all the other things I just mentioned. But sometimes autism is the underlying framework that explains the missing piece of the puzzle. And I hear this all the time from females. So where they've been diagnosed with trauma or ADHD or something else. And they typically say, like, yes, that explains some things, but it doesn't explain everything. There's a huge piece missing. And I've heard this plenty of times from adults in my career to where they were diagnosed with ADHD before 2013. And if you were diagnosed with that before 2013, well, you couldn't have autism. So that was just automatically taken off the table. And these adults are left with this hole. Like, yes, ADHD makes sense, but there's something else that's missing. So now I want to talk about how to correct this. As a diagnostician, as an evaluator, I've done thousands of these evaluations over time. And what this requires is to look at the nuance, really drill down into the cracks. So where if I have a female that comes in here, I don't want to look at just one thing. I want to look at developmental history. I want to look at what the testing says. I want to see what collateral information says. So like they're a parent or a sister or a friend or a partner. What are other people seeing? And I want to understand the patterns across their life, because how autism presents, it can present differently as someone develops over time. So I want to look at not just what's happening nowadays, but what was happening when they were younger as well. Because when someone has been masking for decades, the symptoms are not obvious on the surface. You've got to look deeper. You've got to look at the nuance. You've got to look at the cracks. And you've got to understand the difference between social ability and social exhaustion. And honestly, a lot of women walk into these evaluations afraid that they're going to be invalidated. And I get that. I totally understand that. But when I'm able to see it and that diagnosis fits for them, I see such a huge emotional release because it's one thing to kind of privately wonder to yourself, oh, I might be autistic, and then have a professional who specializes in it say to you, you know what? I see that too. And when women get this diagnosis, it often brings a lot of relief, but it also brings with it a lot of grief. So, where I see folks look back on their life, what life could have been like if they had known. And they also grieve all the years that they emotionally exhausted themselves just to try and fit in. But for many people, when they get this diagnosis, there's also a huge moment of clarity because suddenly their life starts to make sense, right? They're not broken, they're not crazy. This is just how their brain works. And they were adapting. They were adapting to hide that struggle for such a long time. If you've spent years feeling socially exhausted or hyper aware of yourself, or that you felt that interactions with other people are more manual than something that's automatic, well, then that might be worth exploring with someone who understands how autism can present in females and girls. Because sometimes the people who look the most socially put together on the outside are the ones who are struggling the most on the inside. All right, if I didn't introduce myself earlier, I'm Dr. James Thatcher. I'm a licensed clinical psychologist at Forest Psychological Clinic in Portland, Oregon. And if you're interested in some of the research articles that I talked about in this video, please check out the description below. If you're interested in checking out our services for autism evaluations, we do comprehensive autism evaluations. So we look at everything, not just autism. Please check us out at forpsychologicalclinic.com. Otherwise, I will see you in the next video. I hope you like it. All right. Take care. Bye.